Everybody, welcome back to the channel. It's Dr. Jonathan Pearlman, chiropractor in Richardson, Texas. And I'm here to talk to you today about something that doesn't get talked about enough. As a matter of fact, I believe that it's often ignored, and then if not ignored, it's overgeneralized. And what does that mean? That means pain, joint pain or body pain. For the purposes of this particular video, we're going to separate out headaches and we're going to separate out GI or like visceral type of pain. Let's assume that this video focuses on joint pain, back pain, neck pain, foot pain, heel pain, knee pain, and any other kind of pain that you feel in the body that is a nagging pain. And here's the thing. You're going to look up on YouTube, or you're going to look up on Google, or you're going to ask somebody that you know, maybe it's a trainer or somebody that's really fit or that exercises all the time, and you're going to ask them, what do they do about it? Or you're going to type into YouTube, exercises to relieve my back pain. And here's the thing, you're going to find, again, I meant to say a ton of content, and you're going to find a lot of them giving you research as to why it is so efficacious, yes, that's the word, EFF, efficacious, for you to do it, and that the research says and the evidence says that this is what to do. Well, here's what's interesting. Number one, why are you hurt? You see, you can't go around trying to fix something if you don't understand why you are hurt. And if you understand why you are hurt, sprained your ankle, playing basketball, something hit you, you fell to the side, you landed on your butt. These are mechanisms of injury, which is going to definitively conclude to you why you are hurt in a particular region. Now, if you don't have a mechanism of injury and the pain just arose one day, waking out of bed, believe me, you didn't sleep wrong, but you do have to find out what was associated with something you may have done that was more micro trauma. Did you lift over your head to reach for something or paint something? Did you play pickleball or tennis and you hadn't done that in a while? In a video I made recently about whether or not you were deconditioned, that repetitive trauma, what we would call a micro trauma, actually led to a muscle strain of sorts or to a joint fixation of sorts. But sometimes they're not even ones you realize you did that could have possibly led to that kind of pain. And that's just it. You have to be able to definitively define why you are in pain. And then if you can't, that now kind of goes back to, do you have a non-activated muscle? Is there atrophy going on in a particular area of the body due to a consistent neurovascular deficit to a part of the body? That you do need to be having somebody professionally test or examine you to be able to evaluate why that's happening. And then, yeah, maybe that active therapy or that exercise might be right for you. But a lot of the time, what's going to happen is if you've had a mechanism of injury that caused a pretty great amount of pain, those exercises aren't going to do anything for you because this is not a active, let's make motion in the muscle type of injury, to make it better. These obvious reasons why you might be having pain need to be addressed via chiropractic. They need to be addressed via some kind of a physical therapy or a passive modality in order to get you to those active cycles of therapy to be able to build stability in a joint. Again, you want to build stability in a joint, but that should not and really can't be accomplished until you've gone through the passive modality, because all you're doing is putting yourself through pain that's never going to be what we would call desensitized. If you can't change the brain's perception of pain, if you don't do something about the pain gate cycle, that's why chiropractic is so effective, then you're never going to probably achieve that level of pain relief that you are looking for. And again, it's all about diagnosing the actual issue as to why. And being more open-minded is to say, well, I slept wrong, or I just got up and I don't know what happened. You got to kind of actually dig deep. Like a practitioner or a chiropractor, any doctor, they have to do their best, their due diligence to get to the bottom of why you're having pain or what the issue is based off of a thorough history, a thorough evaluation. You as the patient have to really think of what your lifestyle has been like leading up to the pain that you're having to be able to pinpoint some of these maybe not so obvious reasons to you, but are obvious to people like me or my colleagues or other people within the healthcare space. And the last thing that I want to do when I conclude this is, be very careful when you are potentially going to your bro or somebody else who's going to crack or pop your back, because I've got to tell you guys, I'm starting to hear horror stories about people getting manipulated and they are really seriously injured. That's not to a chiropractor. It didn't come from a chiropractor, or if it did, they certainly didn't have the clinical skill to understand why not to do a particular manipulation. And the reason is because if you're a stable, healthy person who has someone pick up and lift your back, that's fine, guys. Like what it's, nothing really bad is likely going to happen from that unless you have a stretch injury in the spine that's re-spraining ligaments. If you have somebody who tweaked their back and then you said, hey, I saw this on YouTube, and you try to like roll them onto their side, and somebody taught you how to do a side posture crack, I'm telling you, if you have a susceptible lower disc, which is a humongous portion of the reason why your lower back would be agitated or in a lot of debilitating pain, is because of a lower lumbar disc injury, then you are putting yourself in grave danger of somebody who has not been trained, how should we say, to a very high standard that could do a ton of damage by, again, straining ligaments and tissue that is way too sensitive, way too acute, much too acute, excuse me, to be getting that maneuver done to you laying on your side by someone who's not skilled. And I'm not saying what makes every chiropractor skilled. Well, certainly people who aren't licensed, if they F you up, I mean, you have no outlet if you then become, totally disabled by a lumbar disc herniation becoming greatly exacerbated, which then reduces, or should I say reduces, excuse me, lengthens your recovery time by many months. Because the older you get and the more serious the nature of the injury, the more you need the expert level professional help so you could get the proper diagnosis and treated properly, which if it's chiropractic, the proper manipulations and the combination and frequency of those manipulations or adjustments, followed up by understanding what the active exercises and therapy is like without overdoing it early on and never getting to that, again, passive healing capability early on. So I hope this video helped. I hope it makes sense. I hope you understand now why you need to seek real, not just chiropractic, but real advice from a referred, person that has your best interests at heart and that is going to help you, heal faster, get better. And guys, I've gone on probably too long. Thank you for tuning in. And until next time, this is Dr. Pearlman.